If your doctor told you, "Don't worry, it was probably just dizziness," and you're over 65, you need to hear this. Because after 30 years in emergency medicine, I can tell you something uncomfortable. The stroke patients who arrive too late almost never ignored dramatic symptoms. They ignored the subtle ones, the tiny warning signs, the strange feeling in the kitchen, the moment their hand missed the coffee mug, the brief spell they blamed on age, dehydration, fatigue, or sleeping funny. And here's the contradiction nobody explains. Most devastating strokes don't begin with collapse. They begin quietly. A little slurred speech that lasts 3 minutes, a sudden wave of confusion while paying bills, a leg that feels heavy walking to the mailbox. Then it disappears. That disappearing act is exactly why people wait too long. I'm not saying this to scare you. I'm saying it because after treating more than 10,000 seniors, I keep seeing the same tragic pattern over and over again. And it's not secrecy that keeps people uninformed. It's that modern medicine often doesn't have time to explain how strokes actually unfold after age 60. The 15-minute appointment slots don't allow for these deeper conversations. The insurance codes don't reimburse for detailed preventive education, so critical knowledge gets lost in the shuffle. Tonight, I want to change that. I'm Dr. Richard Hartman. I'm an emergency medicine physician, and for more than 3 decades, I've worked in trauma rooms and emergency departments treating stroke patients, heart attacks, falls, seizures, and every kind of medical crisis you can imagine. And after 30 years treating more than 10,000 older adults, I've noticed one pattern that appears again and again in nearly every stroke patient who arrives too late for the best treatments. Not stupidity, not neglect, not denial, misinterpretation. People over 60 are often told to expect strange sensations as normal aging. So when the brain sends an early warning signal, many people explain it away instead of acting on it. They've been conditioned to believe that aches, pains, odd sensations, and momentary confusion are just part of getting older. And while some of that is true, it creates a dangerous blind spot when something genuinely urgent happens. In this video, I'm going to show you 3 things. First, the one dangerous pattern I repeatedly see before major strokes. Second, why stroke symptoms after 60 are often subtle and misleading. And third, the exact response protocol I wish every family understood before an emergency happens. Quick favor before we start. I constantly get messages from people who watched several videos and didn't realize they weren't subscribed. Could you check right now? It's free, takes 2 seconds, and it genuinely helps this channel reach people who may need this information before a crisis happens. Now here's why this matters specifically after 60. As we age, blood vessels stiffen. The brain becomes less tolerant of interruptions in blood flow. Balance changes. Reaction time changes. Even the way symptoms present changes. A 35-year-old with a stroke often has dramatic symptoms. A 75-year-old may simply say, "I felt off," and that difference changes everything. Picture this. You're in your kitchen making breakfast. You reach for the cabinet and suddenly feel slightly disoriented. Not spinning violently, just off. Your hand brushes the counter for balance. You pause. You wait 30 seconds. Then it passes. You tell yourself, "I stood up too fast." Or maybe, "I didn't sleep well." Perhaps, maybe my blood sugar is low. 3 hours later, you can't move your right arm. I have seen this exact sequence hundreds of times, and what's heartbreaking is that during those 3 hours, there was a window of opportunity, a chance to intervene, a moment when treatment could have prevented permanent damage. But that window closed while the person was sitting on the couch waiting to feel better. Now here's where it gets interesting. The patients who arrive early enough for clot-busting treatment often come in because family members recognize something is wrong immediately. Someone else noticed the speech change. A spouse saw the facial droop. A daughter visiting for lunch observed the confusion. The patients who arrive too late usually spend hours trying to wait it out. They're alone, or they convince others that it's nothing serious. They shower, hoping it will help. They lie down, thinking rest will solve it. They drink water, assuming dehydration is the culprit. A 2021 study published in JAMA reviewed stroke response delays in thousands of patients and found that symptom misinterpretation was one of the leading causes of delayed hospital arrival. Many patients did not identify their symptoms as stroke-related because the symptoms were temporary or mild at first. That temporary phase matters enormously, because many strokes begin as what's called a TIA, which stands for transient ischemic attack. In plain English, a temporary blockage of blood flow to the brain. Think of it like a kink in a garden hose. Water flow drops briefly. The grass survives. Then the kink worsens later, and suddenly the lawn dries out completely. Your brain works the same way. A brief interruption may create mild symptoms. A larger blockage later can permanently damage brain tissue. Here's the uncomfortable truth. Your brain does not care whether you meant to ignore symptoms. Timing is everything. There's a phrase in emergency medicine, time is brain. Every minute during a major stroke, brain cells die from lack of oxygen. They don't go dormant, they don't pause and wait for help. They die permanently. A study published in The Lancet estimated that nearly 2 million brain cells can be lost each minute during certain strokes. That's why delays are so dangerous. But here's what most doctors don't explain clearly enough. Older adults are trained by life experience to minimize discomfort. You've survived injuries, illnesses, stress, surgeries, financial hardship, grief. So when something subtle happens, your instinct is often endurance instead of alarm. You've toughed out so much in life that toughing out one more strange symptom feels natural. Unfortunately, strokes exploit that instinct. Let me tell you something most doctors don't explain. The brain has no backup storage for oxygen. Your liver can compensate, your muscles can adapt, your kidneys have reserve capacity. But brain tissue is incredibly demanding. It's like a city that needs constant electricity every second of every day. The moment power drops, systems begin shutting down. Traffic lights fail, hospitals lose function, communication networks collapse. And the longer the power stays off, the more permanent the damage becomes. After age 60, several things happen simultaneously. Blood vessels become narrower and stiffer. Plaque buildup becomes more common. Heart rhythm problems like atrial fibrillation increase. Blood pressure regulation becomes less stable. Even the small vessels deep in the brain become more fragile and prone to changes. All of this increases stroke risk. Now imagine your brain as a neighborhood connected by highways. If one highway closes temporarily, traffic reroutes. You may barely notice, but if multiple roads narrow over time, even a small blockage creates chaos. Deliveries don't arrive. Emergency vehicles can't get through. The entire system becomes fragile. That's why symptoms can appear strange or inconsistent. One patient feels dizzy, another suddenly struggles to find words, another notices blurred vision in one eye, another simply feels unusually exhausted, like they could barely keep their eyes open despite sleeping well the night before. The myth: a stroke always looks dramatic. The reality: many strokes begin quietly, especially in older adults. Why that matters? People delay calling emergency services because they're waiting for real symptoms. They're waiting for the Hollywood version of a stroke where someone clutches their head and collapses. But real strokes, particularly in seniors, often look nothing like that. Here's the proof. A large study published in the New England Journal of Medicine found that transient neurological symptoms, meaning temporary speech trouble, weakness, vision loss, strongly predicted future stroke risk, especially within the next 48 hours. That short window is critical. Wait until you hear this next part. The brain region affected determines the symptom. If balance centers are involved, you may feel clumsy. If language centers are involved, words feel stuck. If vision pathways are involved, sight dims or doubles. If motor pathways are involved, one side feels weak or heavy. And here's where seniors get trapped. Many of these symptoms overlap with common aging complaints: fatigue, vertigo, medication side effects, arthritis-related imbalance, low blood sugar, dehydration. Even something as simple as forgetting to eat lunch can cause lightheadedness that mimics a neurological event. So people rationalize. I remember a man in his 70s who spent 6 hours mowing his lawn after developing mild arm weakness because he thought he had pulled a muscle. He finished the entire yard, trimmed the edges, put the mower away. Then he came inside and mentioned it to his wife almost casually. By the time he arrived in the ER, he could barely speak. That story still bothers me. It bothers me because I know that earlier treatment might have changed everything. He might have walked out of the hospital the same man who walked in. Instead, he spent months in rehabilitation relearning basic tasks, because earlier treatment might have changed everything. Think of stroke symptoms like smoke in a house. You don't wait for flames bursting through the roof before calling for help. Smoke is the warning. Here's what the guidelines don't mention enough. The warning signs are often brief, confusing, and easy to dismiss. They don't announce themselves with sirens. They whisper, and if you're not listening carefully, you'll miss them. So what should you actually do? Let's make this practical. If you suddenly experience facial drooping, arm weakness, speech difficulty, sudden confusion, vision changes, severe imbalance, sudden unexplained dizziness, or numbness on one side, treat it as an emergency until proven otherwise. Not tomorrow, not after a nap, not after seeing how you feel, immediately. Here's the exact protocol I teach families. First, stop what you're doing immediately. Do not try to push through. Do not drive yourself. Do not finish errands. Sit down safely. Get to a stable position where you won't fall if symptoms worsen. Second, perform a simple fast check. F stands for face. Is one side drooping? A stands for arms. Can both arms stay raised evenly? S stands for speech. Is speech slurred or strange? T stands for time. If any are abnormal, call emergency services immediately. Try this right now mentally. Could you recognize these signs in yourself within 60 seconds? Most people overestimate their readiness. Third, note the exact time symptoms started. Write it down if possible. Tell someone. Look at the clock and remember it. This is incredibly important because clot-busting medications and procedures often depend on timing windows. A 2018 analysis in stroke found that faster treatment dramatically improved long-term outcomes and disability reduction. Minutes matter. Now here's something families need to hear. Do not let the person sleep it off. I've seen families lose treatment opportunities because symptoms temporarily improved and everyone relaxed. The person seemed better. Color returned to their face. Speech cleared up. They insisted they were fine. But here's what actually happens sometimes. The clot shifts. Blood flow briefly returns. Symptoms ease. Then the blockage worsens later. That temporary improvement can create false reassurance that costs precious time. Another important point after 60, medication interactions matter. Blood thinners, blood pressure drugs, diabetes medications, and heart medications can all complicate symptoms or risk factors. That's why emergency teams ask for medication lists immediately. They need to know what's in your system before administering certain treatments. Some clot-busting drugs, for example, can be dangerous if you're already on specific blood thinners. Here's a simple preparedness strategy I strongly recommend. Keep an updated medication list in your wallet or phone. Include drug names, dosages, allergies, and emergency contacts. This sounds small, but in emergencies, it saves precious time. I've watched families scramble trying to remember medication names while their loved one is lying on a gurney. That chaos is avoidable. Now let me tell you about the pattern I see most often. The patient says, "I didn't want to bother anybody." I hear that constantly, especially from older adults living independently. They don't want to create a fuss. They don't want to worry their children. They don't want to feel like a burden. So they wait. They minimize. They hope it resolves on its own. But here's the uncomfortable truth. A short emergency evaluation is far better than permanent disability from waiting too long. A false alarm is vastly preferable to a missed opportunity for treatment. A 2020 study from Harvard Medical School researchers showed that rapid stroke interventions significantly improve functional recovery and independence in older adults. And independence matters deeply. Most seniors are not afraid of aging itself. They're afraid of losing autonomy, losing the ability to drive, cook, read, walk independently, recognize loved ones, make their own decisions. Fast treatment protects those abilities. Here's what I wish someone had told more of my patients. Calling early is not overreacting. It's intelligent risk management. It's respecting your brain enough to give it the best possible chance. The research on this is remarkably consistent. A major study published in The Lancet Neurology followed thousands of stroke patients and found that early recognition and treatment dramatically improved long-term neurological recovery. Another study in JAMA Neurology showed that patients arriving within treatment windows had significantly lower disability rates months later compared with delayed arrivals. We're talking about the difference between walking independently and needing a wheelchair, between speaking clearly and struggling to form sentences. And here's the critical finding many people miss. Transient symptoms were one of the strongest predictors of major stroke shortly afterward. In other words, the small episode may be the warning shot. A 2019 study from Mayo Clinic researchers found that many patients dismissed temporary stroke symptoms because they resolved quickly. Unfortunately, delayed action increased the risk of severe outcomes. Now here's where it gets interesting. The public often imagines stroke as a single dramatic event, like lightning striking. One moment you're fine, the next moment everything is catastrophically wrong. But biologically, many strokes are processes unfolding over hours or days. That means intervention opportunities exist, but only if people act, only if they recognize that the quiet beginning deserves just as much attention as the dramatic middle or end. Think of it like cracks in a dam. Small cracks don't guarantee catastrophe, but ignoring them increases the risk tremendously. And after 60, risk accumulates faster because blood vessels stiffen, inflammation increases, heart rhythm disorders rise, and recovery capacity slows. That's why wait and see becomes more dangerous with age. Here's what your doctor doesn't always have time to explain. Stroke prevention and stroke response are not the same thing. You can have decent cholesterol, reasonable blood pressure, and still experience a stroke warning sign that demands immediate attention. Risk reduction lowers probability. It does not eliminate urgency. Let's talk about the biggest mistakes I repeatedly see. The first mistake is attributing neurological symptoms to just aging. Aging does not normally cause sudden one-sided weakness, sudden speech changes, sudden confusion, sudden visual loss. Sudden symptoms deserve attention. The second mistake is waiting for symptoms to become severe. Remember, temporary symptoms may still signal major danger. The myth is, if it went away, it wasn't serious. The reality is, temporary symptoms can be among the most dangerous warning signs. The third mistake is driving yourself to the hospital. Please don't do this. Symptoms can worsen suddenly. Reaction time can collapse. Vision can change rapidly. Emergency responders can begin assessment immediately and alert stroke teams before arrival. They can also prevent you from becoming a traffic accident statistic on top of a stroke victim. The fourth mistake is ignoring subtle balance changes. Especially after 70, strokes involving the back portion of the brain may present primarily with dizziness, imbalance, nausea, or coordination trouble. I've seen patients say, "I was just unusually clumsy." No, sometimes the brain is struggling for blood flow. Try this self-check awareness exercise. If you suddenly felt weak or confused tonight, would you minimize it for an hour before telling someone? Be honest with yourself, because that decision changes outcomes every single week in emergency departments across the country. Here's what I wish families understood. You are never wasting our time by evaluating possible stroke symptoms. Never. The research is clear. Early stroke recognition saves brain function, mobility, speech, memory, and independence. This is not speculation. This is decades of neurological evidence supported by emergency medicine data from some of the largest medical institutions in the world. Here's exactly what to do. If sudden neurological symptoms appear, stop immediately and take them seriously. Use the fast check for face, arms, speech, and time. Call emergency services promptly rather than waiting for symptoms to prove themselves. Keep an updated medication list accessible. Tell family members about these warning signs before an emergency happens. Now let's talk about timeline expectations. In the first few minutes, symptoms may fluctuate. You might feel terrible, then slightly better, then worse again. Don't let that confuse you. Within the first few hours, treatment options are often still available if action happens quickly. This is the golden window, the period when interventions work best. By the next 24 to 48 hours, risk of worsening can remain high, especially after temporary warning symptoms. Even if you feel recovered, the danger hasn't necessarily passed, and over months, early treatment can dramatically improve independence and recovery potential. The decisions made in the first hours echo for years afterward. Important safety reminder: not every episode of dizziness or confusion is a stroke. Medication side effects, dehydration, infections, low blood sugar, and inner ear problems can produce overlapping symptoms. But that uncertainty is exactly why evaluation matters. You cannot diagnose yourself in the moment. You need professionals with imaging equipment and diagnostic tools. Always consult your physician regarding your personal medical situation, especially if you have conditions like atrial fibrillation, diabetes, uncontrolled blood pressure, or prior stroke history. Now here's the empowerment message I want to leave you with. The patients I've seen recover best were not genetically superior. They weren't lucky. They consistently acted early. They respected symptoms instead of negotiating with them. That's the difference. And nobody in a rushed clinic appointment is likely to sit down for 25 minutes and explain these patterns to you. There's no billing code for long conversations about subtle warning signs and emergency timing, but understanding these patterns may protect your independence one day. This video is for educational purposes only. It is not personal medical advice. Always consult your physician before making changes to your healthcare decisions or emergency plans. If this type of evidence-based analysis is useful to you, please subscribe and like the video. In the next video, I'm covering the hidden blood pressure pattern I see in seniors who stay mentally sharp into their 80s, including the number range that surprises most cardiologists, and I'd genuinely like to hear from you. Comment below. Have you or someone you love ever ignored a symptom that later turned out to be serious? I read every comment, and your experiences shape what I research and explain next.